If you're dealing with issues like maybe insomnia, or you get a little bit dizzy when you stand up, or just fatigue or a low libido, there's a lot of symptoms that can go along with adrenal fatigue. But we can do this simple test at home just using a blood pressure cuff that you can get at a pharmacy for 30 or 40 bucks. So pretty much every pharmacy is going to sell an automatic blood pressure cuff. So this is what you want to do. Just lie down on your couch or your bed and attach the blood pressure cuff to your arm, and then test your blood pressure while you're lying down. And then take note of those numbers, and then while the blood pressure cuff is still attached to your arm, push the button again and then stand up and take your blood pressure while you're standing. Now, depending on how long the cord is on your cuff to the blood pressure, you might need to set it on a table next to you, or you might need to hold it as you stand up and then try to hold the machine still. If you wiggle it around too much, or you're kind of standing up and jostling about, you might create an error on the blood pressure cuff. And then you got to start the process all over again. You want to do the lying one all over again and then do the standing again. So just try to hold the blood pressure cuff machine as still as you can if you have to hold it when you stand up. Now, what you're looking for between these two tests is you want to see the systolic number, which is the top number on your blood pressure cuff. You want to see that systolic number go up when you stand. Your adrenal glands are in charge of helping us adapt to stresses in our life. So going from a lying to a standing position, that's a stress. That's a gravity stress, and the adrenals should help us increase that blood pressure needed to pump the blood through the system when we stand up, to make sure that blood can get to the head and that we can still know who we are and function as a human being. When that's not happening, sometimes the adrenals may just be a little worn out. They may be called on to deal with stresses too often, and then they get fatigued. That's why we call it adrenal fatigue. So going from a resting to a standing position, we want to see that systolic number go up. So if it doesn't go up, that can be a sign that you might need a little bit of help. Now, I'm not a big fan of treating adrenals, because it feels like it's kind of like whipping a tired horse, when it's tired of running and the jockey guys whip them. I don't know if they still do that or not, but that's what they did when I was a kid. And it's kind of pointless, because it's not going to do a whole lot of good for very long. Eventually, they can only do as much as they can do. What we'd like to see people do is correct the underlying cause of the adrenal fatigue. So if your adrenals appear to be fatigued from this test, it's usually because they're being called on too often to deal with the stress. And the most common stress seems to be a lack of resources that the body needs to run all of its functions. It doesn't have the functions it needs. It's like trying to pay $800 worth of bills with 12 bucks. That's stressful. So if the body doesn't have the resources it needs to run all of its functions, it's going to call on these adrenals to help out a little too often.